Between juggling kids, careers, errands, and everything in between, the last thing that you want slowing you down if you're a busy working mom is foot pain. But if you've noticed that you've got a bump forming near your big toe, it's not just from the shoes you're wearing, it's not just your age, it's something deeper. I'm Dr. Saleena Niehaus. I'm a board-certified podiatrist here in Tampa Bay, and today we're diving into bunions, what they really are, why they happen, how to stop them from getting worse, and yes, how to still wear cute shoes without crying by lunchtime. What exactly is a bunion? A bunion isn't just a bump, it's a structural misalignment of your big toe joint. This is known medically as a hallux valgus deformity. The long bone that sits behind your big toe, called the first metatarsal, it starts to drift inward towards your other foot, while the big toe itself begins to angle outward towards the smaller toes. This creates that bump that you see, a bony prominence at the base of the toe. This can be seen, it can be felt rubbing against your shoes, and it can become painful. But here's where it gets interesting. That bump that you're seeing, it's not just bone. It's a muscle imbalance problem. Over time, stabilizing muscles in your foot, such as the abductor hallucis, which is responsible for keeping the big toe pulled straight back, become weak or overstretch. Opposing muscles like the adductor hallucis become tight and they overpower that muscle. This leads to an imbalance and it pulls the big toe off course and the misalignment worsens. This is why bunions are considered progressive deformities. They don't correct themselves over time, and often they slowly get worse and slowly get larger. The muscles and the ligaments that are meant to keep them from getting larger are imbalanced. So what causes a bunion in the first place? And what causes this muscle imbalance? There's three big culprits. The first one is genetics. Yes, bunions can and do run in families. It's not that you're necessarily born with a bunion or you inherit the bunion itself, but you inherit your foot structure, such as flat feet, hypermobility, high arches, and these make you predisposed to forming a bunion over the course of your lifetime. The second thing that contributes to the development of a bunion is going to be footwear and shoe gear. Now, shoes don't directly cause bunions, but they can definitely accelerate them. Narrow, pointed toe boxes, high heels, pumps that shift your weight forward and force your big toe inward, they can progress a bunion more rapidly if you're someone who's predisposed to it genetically. The final thing that contributes to them is our activities and our lifestyle. If we are required to stand all day for work, and especially if we're doing that in shoes that are less supportive for our feet, we're going to be more prone to developing bunions. If you're a busy mom like me, I get it. We live in sneakers, sandals, flats, anything that's easy, quick, I can slide it on and go. But when the shoe doesn't fit your foot's biomechanics, that very small instability can build up over time and it can lead to the development of a bunion. If you're new to this page, you may be asking, what does a bunion even look like? Usually you'll notice a bump at the base of your big toe. It may look red, swollen, it could even be a little bit shiny in appearance if there's inflammation overlying it. Symptoms from a bunion can include a dull ache or a sharp pain that may be in or just around the joint of the big toe. You may have a hard time fitting into your favorite shoes, especially if they're more narrow in the toe box. You can get pain that flares up after long days on your feet. Stiffness and limited motion in the big toe joint can develop over time. And sometimes you may even get numbness or tingling from pressure on a nerve that runs through that area. Let's talk about what we can do before surgery, because there are so many options that reduce pain, that slow the progression and keep you moving. Number one, shoe gear. This is so important. You want to choose shoes that have a wide toe box or a square toe box design. Brands like Vionic, Hoka, Ultra, and Naturalizer often make stylish options that work beautifully for women with bunions. Look for shoes that have soft or stretchable uppers. Think leather or soft fabric that gives with the bunion instead of pressing on it all day long. A low heel, less than 1 inch, and a firm midsole to stabilize your arch can help to slow down the progression of the bunion and keep you feeling great throughout the day. Number two, gel sleeves and gel pads. These create a soft cushion over the bump. They protect it from rubbing inside of the shoes and they reduce inflammation. That's going to translate to improved pain for you throughout the day. They're great for your day-to-day use, especially if you're wearing closed-toed shoes all day long. Number three, custom or over-the-counter orthotics. The goal with this is to redistribute the pressure and improve the mechanics of the foot. It's important to note that these are not going to remove or change the bunion. The bump is still going to be there, but the goal is to support the arch of the foot and slow down the progression of the bunion while improving your pain. Number 4, avoiding pointed or narrow shoes. Even if you wear them occasionally, limit the time that you're in them. You can wear them for a short event, a meeting, church, something like that, but switch to something that's got more room in the toe box and more supportive for your daily activities and your daily commutes. If pain persists even with these conservative treatments, we can use advanced non-surgical modalities that help to calm the inflammation and promote healing within the joint. MLS laser therapy is a painless laser that penetrates deep into the joint to reduce inflammation and stimulate tissue repair. It's really great for chronic joint pain and swelling around bunions. Shockwave therapy uses acoustic sound wave energy to stimulate your body's natural healing response. This improves blood flow and it breaks down scar tissue formation. It's often done in a short series of sessions and it can make a huge difference in chronic bunion pain. Steroid injections can provide rapid relief when pain is severe. We like to use these sparingly because repeated injections can weaken the joint capsule and may injure joint cartilage, but when they're used appropriately, they're an excellent short-term option. Surgery should always be the final resort and only when pain limits your daily life or conservative care no longer provides you with the relief that you need. There are many modern surgical techniques available, from minimally invasive bunion correction to 3D Lapiplasty procedures, both designed to realign the bones and restore stability. But the key message is, you don't need to rush into surgery. We can often manage bunion pain effectively for years without it. If a painful bunion is left untreated, it doesn't just stay the same. It worsens. It's like driving with your car out of alignment. Over time, we get wear and tear on the joint. The joint becomes more misaligned, cartilage breaks down, and arthritis can develop over the course of years. Your body's going to try to compensate for that pain and for that instability in your bunion. Your gait's going to change. You may start walking on the outside of your foot or overloading your smaller toes and developing pain in the ball of your foot. You can develop calluses, hammer toes, and even plantar fasciitis if a bunion is left untreated. Less common, but we do see from time to time that knee, hip, and back pain result as well. That's why early intervention is so important. It's not just to prevent surgery, but it's to preserve how your body moves every single day. So if that bump near your big toe has been bothering you, if you're seeing redness, you're seeing swelling at the joint, don't ignore it. Whether it's finding better shoes, maybe using some custom inserts, or trying advanced therapies like laser or shockwave, we can help. At Bayshore Podiatry Center, we specialize in helping busy, active women get back to doing what they love without pain, without giving up their style. Schedule your consultation and let's take the next step toward pain-free, confident movement, one foot at a time.